This is something I'm happy to keep talking about because it's really important. But CDI is incredibly difficult to break into. So if anywhere, any place you're hearing that it's easy or just do this and you'll get in, it's not true. You essentially have a couple options to try and break in, and the method you go with really depends on your specific situation and a little bit of what you can handle salary wise, and if like the type of area you live in, like what the options are for acute care hospitals. Option number one is to just keep applying at companies that are RCMs like Ensemble, but their pay may be lower. A lot of nurses will jump into a role like this so that they can gain experience and then go back to an acute care hospital that pays more in line with where they live. And you have the option of playing the long game with the hospital you work at or other local ones. And that's going to take a lot of networking, finding out who the director is, the other nurses who work in that department, talking to them, finding out like if they hire a nurse with your type of experience, what type of experience they're looking for, if there's anything else that you would need to make your application stand out above others, like doing an ACTIS apprenticeship or something similar. And unfortunately, but fortunately, nurses like being in this role so much that there does tend to be very little movement, especially on the acute care side, unless a department is expanding into new payers or picking up other facilities that they didn't previously review. It is a long game if it is at your own facility. We have an anonymous interview from a nurse in our membership talking about how long she waited and who she talked to and what she did to get in at a sister hospital to where she worked. Places I've worked have hired nurses that expressed interest years ago and were willing to wait and see what happened with potential openings as they came up. And once you do have a year or two of experience with CDIP or CCDS, the options really do open up, but truly, I feel your pain. Getting the first job is the hardest part.